I think this is a very important point and very important question as well for all of us to understand. Now, typically, when we say about heart disease, we say a person gets a chest heaviness, which gets radiated to the left arm, or choking in the throat. These are very common symptoms, but they are more common in males. So it is if you see that these are called as typical symptoms, that chest pain radiating to the left arm is a very typical symptom of heart disease. But in females, we get more of atypical symptoms. Now, what can be these atypical symptoms? These could be just feeling of breathlessness, extreme tiredness. There can be pain in the jaw, pain in the back, pain in at the other areas. Now, they may be reflecting or representing a heart disease or an impending heart attack, but they're very unusual symptom, like a little bit of burning, which can be burning in the chest, which can be confused with the acidity. Back pain can be confused with that it is really a backbone disease. Sometimes pain in the throat is considered as some kind of throat problem, or pain in the jaw is considered as dental problem. Now, these are atypical anginal symptoms, and they are more common in females. And therefore, when you don't, because the general perception in the public or elsewhere or everywhere, even amongst the general practitioners, is that if a person gets a typical pain in the chest, that means it's a heart disease. But if you're getting back pain, tiredness, it may be something else. These atypical symptoms are more common in females. So this is what is to be remembered. And therefore, we should have little more aggressive approach. If some females approaches, or some female is experiencing these atypical symptoms which were not there, I think they should go to a medical doctor, get themselves evaluated, so that if it is heart disease, it can be caught early and picked up early and can be treated appropriately. Otherwise, if it remains underdiagnosed or undiagnosed, or if there is delay in taking attention, because people are afraid that it may be a false alarm, and it may not be nothing to do with heart. Everybody will get alarmed, so people don't take attention. But that's a wrong attitude, because it may be a false alarm, I agree. But then if it is diagnosed correctly, and if it's a real thing, then treating it at appropriate time becomes very important to preserve the heart muscles and save the heart muscles from getting scarred and damaged.